name's Kurt Beavers, and I want to welcome you to our Healthy Living Revolution Live. The Healthy Living Revolution is a movement of people who are taking healthy back. And we're offering this series to bring some simple solutions and really good education. Our speaker this episode is Dr. Jan Roberto, and she's a medical doctor from Dayton, Ohio. Let me read you a little bit about Dr. Roberto and tell you what a significant person she is, not just as an amazing lady, but she's a significant medical doctor in our community providing the message of prevention and wellness. Dr. Jan has been practicing family medicine since 1989. Dr. Jan, along with her husband Mark and 6 other physicians, provide comprehensive primary care to over 10,000 patients in Springfield, Ohio. For 30 years, she served as part owner and managing partner of the Springfield Center for Family Medicine, which has recently merged with the Kettering Health Network. She's a board-certified doctor in family medicine, and she's an active member of the medical staff of the Springfield Regional Medical Center and the Kettering Hospital. She completed her undergraduate degree from the University of Cincinnati and received her doctorate of medicine from Wright State University School of Medicine in Dayton, Ohio. She then completed a 3-year residency in family medicine and is a member of the American Academy of Family Physicians. She's passionate about the message of staying healthy by choosing a lifestyle that promotes wellness and longevity. She and her husband Mark have one son, Samuel, who received his medical degree in 2015 and currently is completing a cardiology fellowship at St. Louis University. She has lectured to medical students and family practice residents about nutrition and practice management. They have 2 grandchildren, Cambridge and Winston, and she enjoys the California coast, cooking, exercising, and her beautiful Maltese puppies. Please give me a big welcome for our guest tonight, Dr. Jan Roberto.
Hello, everybody. Thank you so much for taking the time to get a little bit more education on diabetes and, more importantly, what you can do to perhaps prevent or improve your diabetes or prediabetes, as well as just thrive for the future. I am just thrilled to be here. I've been practicing medicine for over 30 years, and so I have seen so many stories and situations that I know in my heart could be taken care of just with lifestyle changes, and that's what I really want to empower you with tonight. And so I was asked over a year ago to consider doing this topic in less than 25 minutes. And, you know, there was part of me that was challenged. On the other hand, I was so busy, I just kept putting it off. Well, I ended up going to a conference last month with my husband, Mark, and we actually heard another physician speak about the same thing that I'm going to be sharing, and I'll give you his resource. But Mark Roberto, obviously my husband, is just my counterpart, and he gave me so many wonderful ideas and encouragement, and so I'm going to give him credit also for helping me pull a lot of this information together so that you can easily understand it, I hope. So what do you think of when you think of the word diabetes? I'm sure some of these words are jumping out at you. And it's really a very complicated subject, both with multiple organs being involved and multiple biochemical pathways. And, I just really want to empower you just with some good basic knowledge. But I'll have to tell you, this is where my head started for the last several weeks, back at biochemistry, energy metabolism, Krebs cycle, gluconeogenesis, lipogenesis, ketogenesis. Okay, if you're medical, you know what I'm thinking about here. And then multiple organs, your stomach, your liver, your muscles, your fat tissues. And so what we're going to do is talk practically here that, diabetes is a huge problem, and it is affecting at least 1/3 of the American population is either diabetic or pre-diabetic. That is not acceptable. And the worst part is that 85 million, almost 1/3, have not even been diagnosed. okay, 10% right now or more, probably 12 because this is 2 years old, have diabetes, but it's this huge growing number that has not been diagnosed. And if it's not turned around, they will be a full-fledged type 2 diabetic within 5 years. And that's where our message comes in. And that's what I'm so excited about. And so what is diabetes? Well, I'm sure you've heard so many things, but I'm going to break it down for you. It's a group of diseases that have in common an elevated blood sugar or glucose. They're the same word, blood sugar or glucose. And it really is a complex disorder of carbohydrate metabolism. Okay, and let me tell you that carbohydrates are not what you think they are. In this case, this is more of a malnutrition, the body getting the foods that it doesn't need or require. And this form of malnutrition leads to this disorder of carbohydrate metabolism. Okay, but we need energy to live, okay? Every food we eat, whether it's a carbohydrate, protein, or fat, has calories assigned to it for a reason, and that has to do with how fast it gets broken into sugar, which is used in the Krebs cycle to make energy, okay? Carbohydrates just are more efficient in terms of their breakdown, and this is where we're putting our energy because so many people eat so many carbs. But we're going to delineate rather quickly here the difference, okay? But in order to live, we want to eat life. I'm going to say that over and over again. In order to live, we want to eat life. What does that mean? We want to eat foods that are alive, not processed or manufactured, okay? So carbohydrates are broken down into glucose, which is sugar, but the carbohydrates that cause most of the havoc in our body are the processed foods, refined sugars, many of the grains, of course your sweets and pastas and pizzas and muffins and cookies and all of those things, okay? But a lot of people don't even consider what's going in their mouth, that whether it is from, a live source or if it's manufactured, okay? But carbohydrates are broken down into glucose or sugar. And as I told my son growing up, too much of a good thing is too much of a good thing. We need carbohydrates to live, but we need the right ones, and we don't need too much of anything, okay? A little bit more balance would do us good, wouldn't you agree? So the result of having a high blood sugar, let's talk about, first of all, before you're diagnosed, there is so much going on. And in particular, it is what we call end organ damage. And this end organ damage happens even before people are diagnosed, okay? And that is the tragedy. And so we look at the eyes. You've heard of diabetic retinopathy. This is a leading cause of blindness. Diabetic nephropathy, which is kidney related problems. This is a leading cause of end-stage renal disease. And down here on the bottom, neuropathy. This is where you have pain in your limbs and different issues with amputations and circulation. And then the two biggies over here are the macro vascular complications, which are stroke as well as cardiovascular disease. So 2 and 4 increase in mortality from 2 to 4-fold for a stroke. 8 and 10 people with diabetes will also have some sort of cardiovascular event. Okay, this is even before diagnosis. The effects here, what we call end organ damage, are already starting up. So this is a huge problem. So let's talk about the word insulin. Now, you probably have heard insulin comes from the pancreas, and that's provided your pancreas is working. And I will be talking, I'll just say it now, this is not about type 1 diabetes, which is when you actually have an autoimmune problem with your pancreas doesn't produce enough insulin and you have to have insulin to live. Okay, what we're going to be talking about is something called insulin resistance, where you have too much insulin because of the foods you eat, then becomes not enough, and then eventually might go on insulin injections. So here's the key here. The key is the insulin, and it unlocks this door. Here's your cell. okay? It unlocks the door to the cell that allows the blood sugar to go in, okay? I wanted to name this talk something about keys and unlocking, but here's my explanation. So insulin is needed to unlock the lock to put that sugar into the cell, okay? So this is how it normally works. You eat, here's a piece of bread, okay, not on the alive list, but full of sugar right away. So when you eat, your body breaks down this food into glucose, and this sugar is one of the body, it is the main source of energy. Like I said, everything gets broken down into sugar. And so you see here the G, the glucose, and we have a series of pictures that are going to help you understand that. So as your blood sugar rises, the body sends a signal to the pancreas to release these keys, this insulin. So it's being released into the bloodstream. And acting as a key, let's look right here as I'm talking, acting as a key, the insulin binds to a place on the cell wall. This is called a receptor, okay? And it helps unlock the door. Here's the door right here to allow the glucose to get in, all right? So, just picture's worth 1,000 words. Here's your key, here's your door, and here's your sugar going in, okay? And that is in a normal state, okay? But what happens? Sometimes that pancreas is just not putting out enough of the insulin. That might be more of a deficiency, which can also happen with type 2. Or down here, your cells just, the insulin is being released, but your cells aren't cooperating, okay? The insulin cannot fully unlock the cells to allow the sugar to enter. And this in red is called insulin resistance. This is what we're going to be talking a lot about here in the next 5 to 10 minutes, insulin resistance. So here's what it looks like over here. You have your key. It's trying to unlock the door, but guess what? The door is not opening. The sugar is not getting in as well as the previous picture. See, it's trying to unlock it, but that sugar is not getting in. So what happens? The sugar stays outside the blood cells, okay? Stays outside, and it needs to go somewhere. Where is it going to go? Well, I have news for you. The liver and the muscle can only take so much. It goes to the fat. It makes more fat cells. Well, it becomes fat in the liver, and then it goes to the fat cells. So extra sugar turns into fat. All right, so some key concepts here. Carbohydrates, and remember, we're talking about the ones that are not from plants, that are not from vegetables or fruit. We're talking about bad carbs, the carbs that 90% of Americans enjoy every single day. They drive hunger. So somebody starts off their day with a piece of bread, a toast, a bagel, pancakes. Guess what? They're hungry in an hour or two, okay? So this carbohydrate drives hunger. You have extra sugar in the bloodstream. And what happens when there's extra sugar? Your insulin goes up, because that's a natural, what is supposed to happen. Insulin is a hormone, and it naturally goes up when you have sugar. It's going to go to work. But when we eat more than we need, or we eat the wrong foods, that extra insulin drives that sugar into fat cells, okay? Too much insulin starts to not work correctly because of the extra sugar, and it gets stored in fat cells, especially around the waist, and there's the increase in the weight. So here's a key concept. You're not going to hear it too often, this simple, but it is really the truth. Increased carbs, increased hunger, increased insulin, increased fat. I'll say it again, increased carbs, increased hunger, increased insulin, and increased fat. And I'll give you the resource of Dr. Sugar, who we heard speak in Florida. And he's also a family physician, but it's the first book I've really read that has sources that I believe, as a physician are very credible, and he's very current, okay? So here's another picture of insulin resistance. This is the problem that we're having is we eat our food, our body, releases insulin, our cells become resistant because there's too much sugar and too much insulin. So what happens? That sugar gets stored as fat, then you feel tired and hungry, and you eat more food. And you make more insulin, and your cells are more resistant, stores the sugar as fat, you feel tired, and so there goes the circle of insulin resistance. I hope that makes sense to you. So you've heard of the hemoglobin A1C. What is that? This is a blood test with a memory, okay? It allows the patient and the doctor to know if your sugar has been high over the previous 3 months. It's a remarkable blood test. And basically when the hemoglobin picks up the sugar in the bloodstream, here's an example, it becomes what we call glycosylated. And that is just a way, it's a blood test that you can measure a percentage of your sugar. And, it's been scaled, and there's, different numbers that mean certain things, but it tells you how you have averaged for the previous 3 months. That's the hemoglobin A1C, or some people just call it an A1C. All right, so how do you get a diagnosis of prediabetes or diabetes? Well, this is the standards as of 2 years ago, 2017. It might have been the end of 17. So just so these are current. Prediabetes is a fasting blood sugar between 100 and 125, and an A1C between 5.7 and 6.4, okay? So there is actually, you can ask to be tested, especially if you are overweight. And I'm not saying obese, I'm talking about a BMI over 26. Okay, 26 to 30 is overweight, and over 30 is considered obese. And you can find your BMI by looking it up on the BMI calculator online. You put your height in and your weight in, and you have it. Diabetics are diagnosed with a sugar greater than 126 and an A1C greater than 6.5. Okay, and so you can write those down, and you can know what your numbers are. Now, here's something very interesting. The higher the A1C, the higher your chances of those end organs to be damaged. The heart, the stroke, eyes, kidneys, neuropathy. Okay, so the goal is always to have that A1C as low as possible. So if you're diabetic, this is what you would get to look forward to. Checking your blood sugar, maybe 2 to 4 times a day. Pills, multiple pills, sometimes 4 pills before you get to insulin. Insulin now, there are 3 or 4 different kinds of insulin to try to help the body process the blood sugar. And then, of course, there's the kind of insulin you have to have because your pancreas doesn't make any. Number 2, the pills. This is complicated. I'm not going to land here for very long, but I just want you to know how difficult it is to sort of explain this. But, here you have your gut and you have sugar that's being absorbed. There's medicine to try to block the sugar from being absorbed from the gut, okay? Then you have the ability here in the muscle to take up sugar. So there's actually medicines to try to improve the uptake of sugar into the muscle. And then the liver will then put sugar out into the bloodstream. And so there's medicines to try to block the liver from, putting more sugar out. And then, of course, there's the fat tissue, the adipose tissue that just freely takes in the sugar and makes more fat. Okay, and then over here at your pancreas, there's medicines that try to help the pancreas secrete more sugar or more insulin prior to it not working at all. So sometimes you will have insulin resistance where there's too much insulin, driving that sugar into the fat and just causing that cycle. But then over time, this pancreas starts to peter out, for lack of better words, just starts to get tired. And then, you just need more and more help trying to get that insulin out of there. Okay, so we don't want to go there, right? So we know that 80% of type 2 diabetes are overweight. And this also, the insulin is a hormone, but so is the fatty tissue, the fat cells, the adipose tissues. They are also a hormone, and they help promote metabolic syndrome. What is metabolic syndrome? That is being overweight, high cholesterol, as well as high blood pressure, and then being part of the high blood sugar scenario leads to further problems. Okay, so we've talked, or you've heard about metabolic syndrome, I'm sure, but to see that it's not just one problem. You have that overweight, obese person that is also physically inactive and is certainly not eating right. But then as a result of this extra weight and this poor nutrition, you have increase in your cholesterol as well as issues with blood pressure. All of this leads to the number one cause of death, which is heart attack and stroke, with or without diabetes. So again, here's your statistics, but we're going to center in on this pre-diabetic. Let's get the word out and change this pre-diabetic state, okay? And how are we going to do that? It's with our lifestyle. It's with the foods we eat. It's how we take care of ourselves. It's the choices we make for our families. This is one of my patients, and he actually was obviously overweight with a BMI of 40. He was pre-diabetic. His A1C, I believe, was 6.5, high blood pressure, high cholesterol, typical metabolic syndrome. He lost weight on his own, came in, and he had lost 62 pounds within 6 months. And I said, "What did you do?" He said, "I didn't want to be diabetic." He had a father that was diabetic. He stopped eating all of the red meat he ate every single day, soda, sweet tea, beer, and decreased his portions. And he added water, fruits and vegetables, and exercise. And his blood pressure improved. He had more energy, sleeping better, and his A1C went down to 5.5. Okay, he took charge of his life. So what we want to do is start looking at our bodies as engines. Okay, and this Dr. Sugar was so interesting to say that we are not a hybrid car. We can't go from electric to gas on any moment's notice. We need to sort of train our body to be more of a fat burner than a carb burner. And without getting into too much detail, your body can supply the energy it needs. You don't need to keep giving it carbs and carbs and carbs, okay? But would you agree with me that we have had mixed messages, sort of a crazy way of how to eat? There was high carb and low fat. Well, guess what? That's led to the last 10 to 15 years. Remember when Dr. Atkins was around, he probably had it a little bit closer, but there was low carb and high protein, but of course we don't want to eat meat all the time. Then there's paleo, Mediterranean, keto, vegan, gluten-free, dairy-free. So what am I here to say? I'm not here to say any one in particular way of eating, but I have a simple remedy. First of all, understand glycemic index. That is the carbohydrate containing foods that have the potential to raise your blood sugar quickly. In other words, sugar itself is a 100, okay? So we want to know how to address that the value of food. So the higher the glycemic index, the faster it is converted to sugar. So if a food is alive from plants, and it's a complex carb, it's going to have a lower glycemic index, and it's going to give you more value. Okay, so many of our vegetables and fruits have, a little bit of fiber in it. Obviously they're from a plant, so they're going to be a lower glycemic index. Those are better choices than the simple sugars, the pastas, the breads, the packaged foods. But I have run across so many people that are carbophobic. and they don't understand that we need good carbs in order to live. We just don't need as many as we once thought we needed. It used to be recommended to have 65% of your diet to be carbohydrate, and now that number is coming down. So you want to choose your carbohydrates wisely. You want your fruits and your vegetables to be your source of your carbohydrate, and some beans, and you'll see here in a little bit. So we want to live. In order to live, we wanted to eat life. Okay, so the bad ones I've stated several times. Not from plants; those are bad. The processed, manufactured, packaged foods, the sweets, the white flour, refined grains, and added sugars. Okay, I have people say, well, what about stevia? Well, I would say honey's a better choice. There's really nothing wrong with caffeine. There's nothing wrong with tea or coffee because they're herbs. Okay, so we're not being deprived here. The good, healthy carbs and fats come from plants. Your vegetables, your fruits, your nuts, your seeds, your beans, your healthy grains. I am not advocating a vegan diet, and I do think that grass-fed organic beef in small quantities, or pork or chicken, wild fish is awesome. The smaller fish are better if you can find them and tolerate them, the sardines and anchovies and herring and salmon. But the point is that you want as much as possible to be from the good, okay, from the good carbs. 2 resources for you. The one over here is Dr. Fung, and he's very popular right now. And Dr. Sugar, my friend over here, does refer to him a lot, and has a whole lot to do with how you eat. There's also one on the obesity code, but on the right is leanandfitlife.com, and Dr. Sugar has a lot of resources for free on that website, including superfoods, and recipes and things like that. But that's a book you might want to have on hand. So switching over to what health looks like is the bluezones.com. And there are several areas in the country that have had a long history of octogenarians. And for instance, Loma Linda, California, this is what their diet looks like. And I'm really excited, and I have another part of my talk that I talk later, not this one, but that I'm excited about because it has so much to do with lifestyle and other choices, more in line with what I believe. And but if you look at their pie chart here, you see, look at the vegetables and fruits, the beans, the soy, they do have some dairy and whole grains and nuts and seeds, but they have a very, very healthy population. So what we are part about, or what I am part of, is this mission to inspire healthy living around the world. And I first heard of Juice Plus over 15 years ago, and it to me was a life preserver. My husband had some early heart issues, and we were looking for solutions. And personally, I never knew the value of good nutrition until 15 years ago. And I'm so grateful because I feel great. I haven't had any health problems. My allergies have improved, and I have that peace of mind. My family has benefited for 15 years, and now 2 grandchildren. And so it's just such a blessing. So Juice Plus is that bridge for what we should eat and we can eat. And it allows our body to have the nutrition of over 30 fruits and vegetables and berries every day, and another 15 plants in a very healthy meal replacement, as well as some omega fatty acids. So I have actually grown up with this research, and the research is what attracted me to Juice Plus. But when I first saw this picture of all of these beautiful fruits and vegetables and berries and grains, I thought, how in the world can you get all of that in your body consistently on a daily basis? And, the produce is grown under perfect soil conditions, picked at peak ripeness, and then the entire fruit and seed, everything is juiced. And then the remaining powder, after the fluid is removed in a very quick controlled temperature, is then put into capsules or soft chewables. And that in itself has been such a safety net for me and for my family and my mother, who's 92 and she still uses her Juice Plus. But the research really grabbed my attention. And when I first started, there were 7 studies, and now there's over 38. And so as a practicing physician, I have my reputation as well to preserve. And I was just fascinated with the fact that this was peer-reviewed journals that had published this independent research at medical universities around the world. And, when I think of diabetes, somebody said, well, is there a one study? I have to say they're all part of diabetes because, first of all, that nutrition gets absorbed. We have extra oxidation with a diabetic state because there's more inflammation. Because of the extra sugar load, the inflammation is very prominent. And it's also, I didn't get this into the talk, a precursor, 4 times chance higher for Alzheimer's dementia if you're diabetic, 2 times increase if you're pre-diabetic. Sidebar there, I forgot to make a slide, but the immune system is supported, it protects DNA, it helps with that microcirculation, cardiovascular wellness, inflammation, of course the skin and health, you can always benefit from that, right? But the immune system is so important with diabetes because, an infection with diabetics obviously can be much harder to deal with. And the actual autoimmune that some type 1s have, I have seen some reductions because their immune system becomes balanced and healthier. And inflammation in general, anything we can do to flood our body with the nutrition of over 30 fruits and vegetables, we want to do that. And we have a new friend on the block, the Omega Blend, and this is all bypassing the fish. And we know that the omegas 3, 5, 6, 7, and 9 are so important for eye health, for cardiovascular health, for brain, for skin, for joints. But with that diabetic, we want those cell membranes to be as strong and healthy as possible. And having this omega on board, we don't know yet how good it's going to be because the research just now is being done. But, just having this choice of, 6 oils, without calories. And, I haven't mentioned that, but nothing so far has had calories. So with diabetics, they sometimes get worried about the fruit and the carb load and all of that, where if they didn't do any of the other bad carbs, they probably could eat even more of the fruits. But I'm saying 2 to 3 servings of fruit a day is still very much okay. But the point is there's no calories. So you get that nutrition of the fruits and vegetables and berries without the calories. Now, a study that I feel is key for this whole story of metabolic syndrome is this study that was done in February of 17, published in Nutrients, done by the University of Newcastle, Australia, showed with men that were overweight. They had only eaten Juice Plus. They didn't do any other lifestyle changes. They had a decrease in cholesterol and their bad cholesterol, a decrease in their systolic blood pressure, an increase in their lean body mass, and a decrease in systemic inflammation. So that impact alone with the cholesterol was a decreased statistical reduction in the cardiovascular risk by 9 to 19%. But more importantly is the change in the gene expression of over 1,632 genes that affected this metabolic profile. Remember the beginning, we talked about that diabetes and the metabolic syndrome was so important, with the being overweight and high cholesterol and high blood pressure. Those were affected in the study. So I think that's just a huge blessing. Let me tell you 2 stories. One is a friend named Janice, and she was type 2 diabetic for 27 years. She was insulin resistant for the first 15. That meant she was on multiple medications and then was put on insulin for the last 12 years. She has been a very good patient, has had that we know of, side effects in terms of heart attack or stroke or eye problems. She had a Juice Plus, the trio, the fruit, vegetable, and berry, a year ago, and the omega 6 months ago. And she was excited because her A1C in the last 6 months has decreased from 7.6 to 7.0. and her energy level is great. So I thought I'd just shout out for Janice. And my next friend is Steve, and he also is type 2 diabetic, insulin resistant for the first 3 years, then on insulin for 14 years. Now, Steve's story is not quite as without problems as Janice. He was a fire chief, and he had his first heart attack 15 years ago when he was teaching a paramedic course. He had sudden cardiac death, and they resuscitated him. He did live. They put a defibrillator in him after they defibrillated him, after his hospital stay, and he's had that AID in place, and even now I think I just heard that it went off for the first time. So that was 15 years ago, but in the last 18 months, he had 2 more strokes and another heart attack. He started Juice Plus, the orchard or the fruit, vegetable, and berry, and the omegas just 4 months ago. And he's eating better. He has more energy. He's retired several years ago, but just recently his evening insulin dose was decreased by half. And that was huge for him. And, look at his risk factors. Look at the problems he's had so far. And so, he's on a healthier path. He's making good choices. He's exercising, but, a little bit different than the other story. So Juice Plus also has a complete beverage that is very healthy. It's a good combination of that protein, carbohydrate, and fat. It has 13 grams of plant-based protein, 8 grams of fiber. I forgot to tell you that too much protein can be bad because that also gets stored as fat. And so for those of you that think you need high protein all the time, let me tell you that's incorrect, okay? You do need protein to live, but you don't need mega doses. You need more of a balance between your carbs, your protein, and healthy fats, okay? But you have your ancient grains and sprouts, and being vegan, low fat, low sugar, low glycemic, gluten-free. It is the perfect combination with a very low carb load of only 20, and your goal might be, depending on your weight and size, 80 to 100 a day. Protein is 13 grams. So Juice Plus is not about treating or curing any specific condition or disease, including diabetes. It doesn't cure, but it certainly can support. It can support the body to become healthier. It's very dense with nutrition. We have all of this research, and it really is the next best thing to fruits and vegetables. Now, we do have a program that happens about once a month or anytime you would choose, with lots of resources. And I have to tell you, I have done this not even consciously, off and on, for the first year, and now it's pretty much the way I live. I might not get in 2 shakes a day, but I have 1 shake with double the everything. And drinking water and sleeping and exercising and eating real food, of course, eating the capsules every day, but just the gluten just doesn't necessarily serve me. There's other ways to get in my grains. Caffeine and alcohol, maybe decreasing that some, but getting rid of that processed foods and the artificial and refined sugars, and not eating late, having a longer period of, I don't want to say fasting, but that is what I'm saying, 12 hours at least, maybe 16, so the body can burn that stored fat for energy. And then you start moving more towards being a fat burner than a carb burner. And you start getting more satisfaction with the foods that you do eat. I know I said before caffeine and tea is fine, and it's an herb, but on this purpose, sometimes you do need to kind of clean everything out for 10 days. But most of those principles are something that you can live on all the time. So hopefully you have learned something that you can implement. The key truly is living that healthy lifestyle and being able to take your health to the next level. Thank you for the opportunity of this challenge to explain this information in a way that I hope serves you and those that you love and care for. Have a great day.
Great job, Dr. Roberto. We would like to remind you to get back with the person that invited you to view this webinar tonight so that you can learn more. There's great materials online, and they would be happy to answer any of your questions. But first of all, I want to really thank Dr. Roberto for sharing with us tonight, taking a little bit of time out of her busy schedule. And I want to thank you for joining us on the Healthy Living Revolution call series. Have a great night.